Driving while drinking or impaired driving threatens not just your teen and their passengers, but others on the road as well. Drinking alcohol is illegal for people less than age 21, as is driving after any amount of alcohol. Yet in 2019, 24% of drivers aged 15 to 20 who were killed in a motor vehicle crash had been drinking. Any amount of alcohol or drugs produces impairment in teen drivers and is illegal. The combination is deadly. Drinking any amount of alcohol before driving increases crash risk among teen drivers, a much higher risk than older drivers at the same blood alcohol concentration, even at levels below the legal limit for adults. Results from the 2019 National Youth Risk Behavior Survey revealed the following. Among U.S. high school students who drove, 5.4% drove when they had been drinking alcohol at least once during the 30 days before the survey. Driving after drinking alcohol was higher among students who were older, male, Hispanic, or had lower grades. 16.7% of U.S. high school students rode with a driver who had been drinking alcohol at least once during 30 days before the survey. Riding with a drinking driver was higher among Hispanic students or students with lower grades. Students who engaged in any other of the transportation risk behaviors measured by the survey were approximately 3 to 13 times as likely to have also engaged in driving after drinking alcohol at least once during the 30 days before the survey. According to the CDC, in 2019, 15% of drivers aged 15 to 20 involved in fatal motor vehicle crashes had a BAC of 0.08% or higher, a level that is illegal for adults aged 21 or older in all U.S. states. In 2019, 60% of drivers aged 15 to 20 who were killed in motor vehicle crashes after drinking and driving were not wearing a seatbelt. For young drivers involved in fatal crashes, alcohol involvement is typically higher among male drivers than among female drivers. In 2019, 20% of male drivers aged 15 to 20 years and 14% of female drivers aged 15 to 20 years involved in fatal crashes had been drinking prior to the crash. After alcohol, marijuana is the most common drug associated with impaired driving. Marijuana has negative effects on judgment, motor coordination, decision-making, and reaction time, all of which are important skills for safe driving. Regardless of age, acute cannabis intoxication has been associated with an increased risk for motor vehicle crashes. Results from the National Youth Risk Behavior Survey revealed that in 2017, among U.S. high school students who drove, about 13% drove when they had been using marijuana during the 30 days before the survey. Risk for motor vehicle crashes appears to be higher when driving after using both marijuana and alcohol as compared with driving after using either marijuana by itself or alcohol by itself. In order to reduce your teen's risk of crash, ban your teen from driving after using alcohol or other substances and from riding with anyone who has used alcohol or other substances. Also consider the use of alcohol ignition interlock system on the vehicle your teen drives. Have your teen agree that they will refrain from using alcohol or other substances at all times. This is one of the teen rules that is established as a part of the Checkpoints Parent-Teen Driving Agreement. Let your teen know that even if they ever make a bad decision and have become impaired from a substance such as alcohol or drugs, that they should contact you to provide them a safe ride home. Tell them to always contact you rather than placing themselves and others at extreme risk of crash if they drive impaired.